I spoke on Substack Live with Dr. Zachary Rubin. We talked about the MAHA initiatives, MAHA, Make America Healthy Again initiatives, including the Tylenol pregnancy stuff and vaccines and all of it. We also talked about what is the best way to get to everybody in the country having access to care they can afford that is of good quality. And we also were talking about an issue we haven't delved as much into, which are the cuts to research grants all over the country, NIH and other institutions. Really good conversation. You could have watched it live on Substack. We're including it here on the show.
It is great to be speaking again with Dr. Zach Rubin. We have, since we last spoke, in fact, so much has happened that there's sort of like, where do we even start? But I always appreciate your time, and it's good to see you.
It's good to see you again. Yeah, I mean, there's so much going on right now. It's hard to keep track, but we'll do the best we can to cover as much ground in as little time as possible.
Let's maybe just start with this entire Obamacare subsidy healthcare plan thing that's going on. We've joked, but we're joking about something very serious, that we seem to always be 2 weeks away from whatever is Donald Trump's plan for healthcare. And this started really in August of 2020 when he told Chris Wallace on Fox News, within the next 2 weeks, we're not only going to release, but we're going to sign into law my healthcare plan. That didn't happen. We learned during the debate last summer he has concepts of a plan, but not a plan. To his credit, we finally have an inkling of what the plan is. And it's some version of give the money to the individual insured person to have them go out and buy a plan from the health insurance company. When I hear this, I hear there's absolutely no leverage for an individual to do that. And it would really, to work, require government involvement in negotiating, which is, I guess, what Donald Trump doesn't want, because he says government should be out. It should just be free market. Tell us, why this fundamentally wouldn't work.
Yeah, so I want to remind people, even before we get into this, that a lot of the reason why this has become unaffordable is actually from Trump's first term. So the way the Affordable Care Act was meant to work is that if everybody pays in, just like with universal health care, you have diluted the risk pool to decrease premiums, right? You take healthy people and people with chronic conditions, you put them in the same pool, everybody's going to pay a fair share. And if you don't, there's going to be a penalty associated with that. And that penalty was fairly nominal. It depended on your income level and whatnot, but it would be a few $100s. And in 2017, with the Tax and Jobs Cut Act, he made that penalty zero. So that really disincentivized people to buy into the ACA marketplace, which shot up premiums at that time and has still been lingering. There's something called cost sharing reductions, which were discounts from the federal government put on insurance companies to pay for lower income Americans for things like copays. He got rid of that as well. He also got rid of a lot of funding meant to help administrative costs to get people enrolled on plans. So there were a lot of people who were struggling with even just getting onto the Affordable Care Act with the different types of plans that were available. So he already set it up for failure. He sabotaged it. I just want to remind folks that. And so what he has now set up is we just got out of this shutdown, which was over a specific set of subsidies that were put in place because of the pandemic, because costs were just going out of control with supply and demand issues, right? There's inflation going on. And so the federal government had to come in to put in a subsidy to decrease these premiums, which is set to expire. And he's saying, well, instead of taking that pool and just actually subsidizing your care, we're going to give that individual amount of money to each person and say, you go be the entrepreneur and go out and do something with it, which I want to give an analogy for folks, right? You got a Costco or Sam's Club membership, you pay a $50 fee, right? Something like that, in order to get access to discounted bulk pricing. Well, a bunch of people put that $50 in to give a larger buying power so that Costco can go out and then negotiate a lower rate. But if you give that money and say, no, go to Costco, here's your $50, you can come in, but you've got to negotiate to get your bulk granola bar price down, you're not going to be able to do that. You can't, as an individual, do that. It's the same thing with insurance. If you're an individual person, you go out and compete with a private multi-billion-dollar health insurance industry that is for-profit driven, they're going to laugh at your face and say, nope, we're not going to change anything. If not, in fact, we're actually going to increase the premiums, especially if you have a pre-existing condition. It's going to go back to what happened pre-2010, pre-ACA, where a lot of people couldn't even get access to health insurance. We're talking over 20 million people couldn't because of chronic conditions. And depending on the state you live in, you may be out of luck because a lot of states will turn to these models where you're going to have a wait list that if you don't enroll right away, you may not even get coverage. And then there'll be lifetime maximums. These are all things that people don't remember were happening with a relatively broken system that the ACA helped. It's not perfect, but it was definitely sabotaged under Trump's first term.
Yeah, the way I like to say it when they would say, oh, the ACA is clearly not working because the Obamacare marketplace plans are they've gotten more expensive since 2010. It's like, well, yes, it has been 15 years and premiums going up is something that is happening inside and outside of these marketplaces. From the reports I've seen, the rate of premium increases within the marketplace has been slightly slower than outside of it. So it's like, it's better, but the system is so broken overall that you really need an overhaul. And Trump's overhaul sounds to me like it would not actually help much.
No, it's not. He's trying to treat this as if health insurance can operate under a free marketplace. But with the way that the system's set up, that's nearly impossible. This is why I'm in a small private practice, but there's very little of that left. That a lot of small offices have been bought up by these different corporations. That you have private equity and these different large corporations buying these smaller practices up, consolidating it, and then putting it in a model of saying, well, you're going to have only 10 to 15 minutes to see a patient. You've got to just see people like it's a mill, and people don't get enough time with their doctors because of it. In addition, a lot of people left medicine because of the pandemic and were just completely burned out or got really sick. There's a lot more disability now. And now, with the One Big Beautiful Bill, if you go to medical school, your federal loans are capped at about $100,000 or so. It's not nearly enough to offset the rising costs of medical education. So, if you really want to overhaul the system, a lot of countries are already doing this. If you have a single payer system, you're cutting out all the middlemen. You're negotiating essentially with hospitals and saying, this is what it's going to be. Here's the pricing. We're going to cut out a lot of the administrative paperwork. Yes, it may take a little bit longer to see a doctor, but it's going to significantly drive down the costs if everybody's paying into it.
From all of the different things that might be under the MAHA umbrella, Make America Healthy Again, the stuff that RFK and others have been pushing, what do you think from a public health standpoint has been most damaging? And just to remind people in the audience, we've, heard about the Tylenol autism stuff, vaccine recommendations, even for vaccines that aren't available in the US. Get the and R separately, which every doctor I speak to says, yeah, we don't have that. We can't get it. That's not even really a possibility. If you go through the whole list, what do you think is the most dangerous of it?
So, the popular catchy headline things are the ones that you talked about, but I think actually the one that's more damaging is the brain drain that we are experiencing in our research institutions, like the NIH, as an example, because a lot of the researchers have been constrained with their ability to even just access funds out of their grants. My wife and I were in DC recently. I was giving a talk for a food allergy conference, and one of her close friends is a researcher over there, and she won't I'm not going to name her name and keeping her private because of, concerns about her safety and her job, she's not going to speak out openly. So I'm just making this as an anonymous source. But she sees all these different PIs, these principal investigators at the NIH, who are just leaving left and right. Her personal boss left for St. Jude's, and she was going to try to look at 7 to 8 other people to work with. They've all left. People are leaving because the leadership is so bad right now. It's so absent-minded and so driven towards politics to decrease funding for DEI type initiatives for health disparities, that over 700 NIH grants had to be altered to change the language in order to get accepted. And even then, when you have grants, sometimes they're not even able to have access to funds. And we did have the shutdown, which stopped the ability for people to run their experiments. If you had something ongoing, except for basically feeding the mice, as an example, you couldn't really do anything, and that ruined experiments. So a lot of people are leaving the states or they're going to private institutions, and it's really, I think, from a generational standpoint, it is going to have ripple effects that we're not going to see right away, but it's devastating.
That makes a ton of sense, and that's like a structural thing that we have been talking about and seems extraordinarily damaging that's taking place right now. As far as even without delving super specifically at the micro level, one of the things that I found notable is that with a lot of the so-called recommendations that have been coming out, someone will eventually always kind of couch it as, you should talk to your doctor and only take medications when they're truly necessary. And what's funny to me about that is that's kind of always the situation. In other words, the idea that for no reason people are taking Tylenol or whatever. My approach has always been, do I really need this thing? What symptom or condition am I trying to deal with? And what does my doctor say about it? They drop that in a way which makes it sound like a new part of this. But isn't that what really should be the approach to putting anything in your body?
It's always been that way. I always tell my patients I try to do the most with the least amount of intervention. And this, especially too, as somebody who specializes in allergic diseases, you don't want to over medicate. You don't want to do those things. And I go over the risks and benefits with all my patients. I'm lucky as a specialist and the way my practice operates that I have more time than potentially other doctors do. Primary care is really taking the brunt a lot of this by saying, in order to keep the lights on, you got to see patients every 10 minutes. That's really not doable, but that's kind of the system that we're unfortunately facing with. But when I have more time, I can explain to people why I don't do nearly as much testing as other people do. I don't recommend taking medications all the time, and I really follow them closely to really monitor what's going on. And that's something that I've always done. But what the administration is doing is they're basically giving this conspiratorial thinking that doctors are paid by big pharma, that we're just pill pushers, that we don't look at the quote unquote root cause, when really we talk about it from terms of pathophysiology, which is the same exact thing. And we have a level of humility where we say, hey, I may not know the answer to this. We may need to follow this further. We may not have the answer to everything. But that's really how good medicine is practiced. And even with that, our systems from a public health standpoint are not set up to really support people, and doctors can only do so much. So if you live in a food desert, that's hard to get access to healthy, nutritious foods. I don't see the administration really taking steps to improving healthy food access, right? They were very much against funding SNAP during the government shutdown. That made absolutely no sense to me, right? I think from just a humanistic standpoint, you'd want to make sure that everybody can eat and not go hungry. It boggles my mind that that was an issue. We don't have universal childcare. We don't have universal parental leave. All of these are toxic stressors. We're not addressing enough of the climate impacts on our health. And these are things that you would think MAHA would be aligned with, removing pesticides from our foods, but they're not actually doing that. They're just hunkering down on old conspiracy theories that have been thoroughly debunked, like vaccines and autism as an example, and they keep shifting the goalposts to focus people on the wrong aspects, or reinvigorating the population with beef tallow, which we know is not going to improve people's health. All of these different things are distractions from the real systemic issues that our society faces.
I'm curious your thoughts on Dr. Marty Makary because I read his book a couple years ago, I think it was, and there's some stuff in there that seems very evidence based about, hey, appendicitis can be treated much more successfully with antibiotics than we thought. A lot of people that get an appendectomy, like me, for example, I might have actually been fine with the antibiotics. Or another example, are we too quick to go to C-section in the United States, especially after a woman has had one C-section already? And it seems like, yeah, that may be a thing. There may be better chances for vaginal birth after C-section than maybe we thought. Stuff that when I would do independent research seemed very evidence-based. And then to see him standing up there with Trump and RFK and repeating some of this stuff. I don't know. What do you make of it? Do you think his views have genuinely changed? Do you think he's been captured by the political environment in which he finds himself?
No, actually, he's always been on that side of things, actually, when you look at some of it. So on the one hand, yes, he talks about things that are advancing medicine in a positive way. He's not the one who is the one figuring this out, though. This is stuff that a lot of other people were already looking into. But as an example, he famously talked about how medical errors are the third leading cause of death in the United States. And that kind of put him to the forefront when that was taking things wildly out of context. we're talking about hospital outcomes rather than, the cause of death as a whole. It's cherry-picked information, and that really sowed distrust with the medical community when he said stuff like that, which was very problematic. He's also somebody who said that we would reach herd immunity with COVID-19 back in the spring of 2021, which clearly a million plus people passed away after that point, so he was wrong with that. He's a surgeon, and he has some good ideas, but then he'll also blame doctors for the only reason why there's a peanut allergy epidemic that's going on, and that's not the only reason that has caused that. I have a book behind me that I've written that goes into more details about those issues. But I think because he kind of balances the line between having evidence-based information, but then really having this hyperbole of information that over-exaggerates risks and over-exaggerates that the harms that doctors do, it doesn't create a balanced approach. This recent announcement about removing the black box warning for hormone replacement therapy for treating menopause has a lot of merit to it, but he has people up there saying that, oh, the reason why a lot of women are getting divorced is because they're not on hormone replacement therapy is absolutely ridiculous. So some of the messaging behind things that actually have good science and advancing things often get lost in the kind of showmanship that he displays.
Is the effect of what the Department of Health and Human Services is doing right now, is the effect more tangible or ideological in this way? My friends in blue states say, hey, you know what? Our governors and our state attorneys general and state medical directors, for the most part, are all keeping everything as far as the legal infrastructure goes the same. So even though at the federal government level, they might go, oh, a 40-year-old no longer qualifies for the COVID vaccine, for example. A lot of states have figured out ways to say, no, we're going to prescribe it to everybody so you can just show up and get your COVID vaccine or whatever. So the question is the damage that's being done more about people who hear this stuff and choose to do something different versus what is actually accessible on a state by state level based on state leadership?
Man, that's such a hard question. I think they're both damaging is the thing. The messaging is so mixed and confusing that you're going to get fringes of people who are going to go in opposite directions and actually create more distrust in the federal government. I mean, the CDC was once an institution that was considered the pinnacle of public health around the world. They did such a great job when there was an Ebola scare about 10 years ago, just
Yep.
completely stopping that in its tracks. There have been concerns about bird flu for a long time that they've been able to successfully address. They helped really address issues related to a swine flu pandemic that happened back in about 2009, 2010. So these are things that they have now actively dismantled the structural integrity and the funding that's in place and kicked out most of the career scientists where even if the state level they're doing everything they can to patch it up, there may not be enough funding to address some of these problems. I mean, one of the big problems right now is we're having all sorts of food recalls and safety issues with our food supply. One of the scariest ones right now is the fact that there's a formula company called ByHeart that had to recall all of their formula products because there was cases of botulism linked to that formula. We don't know all the details yet. It's an ongoing investigation, but there was funding through something called FoodNet that was meant to track things like botulism and listeria and things like that. And they cut so much of that funding at the CDC that's federal assistance for the states. And so there's both a messaging problem, a funding problem, and a resource problem that's coalescing that, yes, if you live in certain states, you may be more protected. But by and large, we all suffer because of this.
We are going to be modeling different healthcare systems from around the world, which we've done before, but it seems like a particularly interesting time to do it. And my view has been, I think there are a number of different ways to make sure everybody has coverage and coverage that they can afford and that is of acceptable quality. Different countries around the world have taken different approaches. If you look at France versus Singapore, for example, or Switzerland versus Spain, there is not one system that achieves certainly good outcomes. Do you have a preference in terms of the way to get to the system you think is ideal, or are you sort of agnostic as to how we do it, as long as we do it?
Yeah, so there's some type of flavor of a centralized universal system that needs to be employed at this point to cut out a bunch of the middlemen that are rising the costs of care. We have so much administrative bloat in our system, so much paperwork that is unnecessary and hoops to jump through that I'm all for a single payer system if that means I can spend 2 hours less of my day on paperwork or my nurses having to make all of these different phone calls to get access to things. The downside, though, is that if we don't address some of the other systemic issues of getting people into healthcare to make it more affordable, it's not going to be sustainable. We have a physician and a nursing shortage right now that in some parts of the country it would be very hard to get access to certain doctors. And I was just in Canada recently at a conference that I was speaking at, and I was meeting with a bunch of other specialists like myself. And like in Newfoundland, as an example, the entire province has 5 allergists for the entire province. Their wait list is anywhere between 12 to 24 months to get in for a routine issue that's
Wow.
related to my specialty. So there is some risks of having long wait times. That is real. That's not fake. That's a real downside to this. However, people shouldn't go bankrupt if they have a medical emergency. It's unconscionable to even talk about. It doesn't matter what your citizenship status is. Everybody should be able to have access to care. It's a matter of how do we deliver that care that is equitable, but also not going to cause burnout for the system itself, because a lot of physicians and healthcare workers are burnt out with the way things are going right now. And we need to find ways to support those individuals, but also support society as a whole. And by having a single payer system, at least gives that bargaining power to decrease the costs and decrease the administrative bloat that leads to a lot of these issues. Now, some places will have that plus a private option, which might be viable, but it's hard because we live in a unique kind of system where we have both federal and state issues. That's a large country. So there's so many different political interests and different ways that people do things that, I wish we would be able to have it. I just don't know how that we're going to ever get a pathway to get to that.
That's the question. And I don't, it's certainly not going to be with what Trump was dangling in front of us just 2 weeks away for 5 years. We figured out that's not going to be the path.
Oh, of
We've
course.
been speaking here with Dr. Zach Rubin. If you're one of my Substack followers, make sure you're following him. I would be humbled if you're one of Dr. Rubin's followers, if you followed me on Substack as well. I know you've got a busy day ahead of you, so I'll let you go, but I always appreciate talking to you.
Oh, it's a pleasure, my friend. And just have me back on your show. We'll chit chat more because we only scratched the surface with everything here.
All right, we'll talk to you soon.
All right, take care, guys. Bye.
Take care. Bye.